Tonight, new warnings that Obamacare could put your privacy in jeopardy. 13 Republican state attorneys general saying that the new healthcare navigators could cause your private information to go public, and they are taking their concerns directly to HHS. Florida Attorney General Pam Bondi joins us. Attorney General, thank you so much for being here. I think that people are a little bit confused about who has an exchange and who doesn't have an exchange, which states. But these navigators are, you think, could cause a huge problem, especially when it comes to privacy.
Dana, absolutely. And let me explain. For Patrick Morrisey, the great Attorney General from West Virginia, brought this to our attention. And identity theft, as we know, is rampant in our country. And if I could first just define what a navigator is. A navigator is someone who is hired by the federal government, and they've already invested over $67 million in hiring these navigators. Navigators assist consumers who wish to enroll in insurance programs under the Affordable Care Act. Now, here's what's happening. Because of time constraints, and the Wall Street Journal reported this about 10 days ago, because of time constraints, HHS, they're cutting back on the requirement to become a navigator, meaning they're not going to be doing background checks, they're not going to be fingerprinting these people, and it's more than navigators, it's people that assist the navigators. Now, these navigators will have our consumers throughout the country's most personal and private information, tax return information, Social Security information, and our biggest fear, of course, is identity theft. Even, Dana, federal requirements now for census takers, even state requirements, are so much tougher than the requirements for these navigators. So we've sent a letter to HHS asking by August 28 for them to respond to us and tell them, because we have many grave concerns over the numerous deficiencies in what's happening. In fact, they've cut even the training for these navigators from 30 hours down to 20 hours.
And so when HHS gets a letter like this, I would imagine they're just overwhelmed with how many people are complaining about different parts of it. But, Attorney General, they had Kathleen Sebelius, the Secretary of HHS, she diverted 20% of the money that was supposed to go towards disease prevention to go to these navigators. Do you think that they have any sort of concern about the money that was supposed to go to actual care, like disease prevention, to actually then going to bureaucrats who are going to get your private information and then using computers that may or may not be secure enough to be able to protect that from getting into the public's hands?
There you go. And Dana, that's our exact concern. They've invested $67 million of our tax dollars to go to these navigators who are not receiving adequate training. The training they're receiving, they've cut back by 10 hours. They're not committing to doing fingerprints on them, background checks. We don't even know if they're a criminal. What if they've been convicted of committing identity theft or grand theft before? They could potentially still become a navigator. We need questions answered. We need to know who's going to be monitoring these navigators, who's going to police the navigators. We have no answer to that. We need to know who's going to notice our consumers that this is happening, that when they give up their personal information, they have no safeguards. We need to know who's going to be liable if someone's identity is stolen. We want to know who's going to educate them on fraud prevention. There are so many issues out there, Dana, that are still unanswered, and our consumers have to know this. This isn't a political issue. This is an issue about protecting our consumers and their identity from unscrupulous people, and we know they're out there all over our country.
It's interesting that there's so much concern about the NSA program that expressed by people concerned that their phone records are being looked at by the government. I actually think that my health records, to me, personally, are more of a concern. I actually even heard there was one insurance company that was requiring your BMI to be listed, and I don't want anybody to know about that. Would you support a delay in Congresswoman Marsha Blackburn on the Energy and Commerce Committee in the House? She has a bill that she's sponsoring that would be a one-year delay. Would you support that? The attorneys general, could you get behind something like that, or do you think that that's not worth going down?
Well, let me tell you, we have to have answers from Kathleen Spellis, and we've asked her by August 28th for that very reason, because we have to have safeguards in effect. Our jobs as attorneys general throughout the country is to protect our consumers in our states. And that's why it's so very, very important that if someone's going to give, like you said, all their personal health information, social security number, tax information, it makes it so easy for an unscrupulous person to steal your identity. And that's what we care about. So we need to see what the answers are. They've obviously invested multi-millions of dollars into these navigators. Now we need to have them trained. And no, an excuse is not acceptable. It's not acceptable to say, well, we're running out of time, so we're just going to let these people come in here and have all of your private information. Consumers deserve better, and this country deserves better. And hopefully they're going to listen to us and put more safeguards in effect.
Plus, there could be a computer error along the way. All right, Attorney General, thank you so much.
Exactly.